Hello everyone, good afternoon. My name is Arun Pherwani, Dr. Arun Pherwani in the Seychelles, or Mr. Arun Pherwani in the UK. I'm a vascular surgeon. I trained and worked and I work in the UK. And I'm sending you this message from this gorgeous place, Seychelles, which has become very close to my heart. I trained in vascular and renal transplantation, vascular access, etc. in Northern Ireland during the Troubles, and I started as a consultant in Stoke 20 years ago. About in 2008, the opportunity presented itself to come to Seychelles, and I've been coming here for the last 15 years, and it's one of the best things that I've ever done. The renal failure population here was quite small initially, but at the moment we have 189 patients on dialysis here, and over 90 of them are dialyzing with necklines, which is terrible. When I first came here, I saw patients with non-tunneled necklines sitting like antennae out of their necks, and it was quite terrible actually, the way these poor renal failure patients get treated. And that's not just in Seychelles, that's worldwide. So as I said, I've been coming here for the last 15 years. I do this in my own time. I take annual leave, and the government and the healthcare agency look after me, and they organize my trips. The staff in the dialysis unit here are absolutely magnificent. Miss Sino, now Miss Flora, and the other staff are superb, and they are the real patient advocate here. The problems here is that patients don't get good quality of dialysis surgical care, so vascular access procedures for dialysis. They get very good quality dialysis, particularly since AMSA took over the provision of dialysis services here in the Seychelles, so that is outsourced to AMSA. The quality of dialysis the patients get is actually very good. It is world class. The dialysis units, both Unit 1 and Unit 2 with the machines, are absolutely world class, and it's no different to anywhere else in the world, including the UK. The problems though here are patients who have long-term dialysis catheters, and as a result of that they have central venous stenosis, which means surgical access is virtually impossible in some patients. Dialysis catheters are associated with greater infection risk, and quite simply patients with catheters don't dialyze as well, don't live as well as long. There are also no transplantation facilities here, and only the rich or the people with available donors can travel to other countries, particularly India, to have living-related transplantation here. So some of these patients are condemned to a life on dialysis 3 times a week in the hospital here. Seychelles has a population of nearly 100,000, and hypertensive nephropathy, diabetes in particular, are now increasing, and therefore there's a high incidence relative to the small population of renal diseases here. The sea gives you everything. You have beautiful food from the sea, the fish, you have such fantastic vegetables. This place is real paradise actually, but our health here is very poor. There's a high incidence of cigarette smoking, there's a high incidence of drug use, there's very poor attention to health and diet. There's a lot of processed food, and you see a lot of young people who are obese, and obesity is now another big problem, healthcare issue in Seychelles. Along with this comes renal failure and eventually cardiovascular disease, which is the biggest cause of death. Hence, prevention needs to be patient education of children very early in life, attention to diet and exercise, attention to a healthy lifestyle. As I said, you live in paradise, so it is easier for you here than most others in other parts of the world. And when one does have vascular disease, renal disease, etc., attention to detail with not smoking, not consuming excessive alcohol, diet, the fluid and dietary restrictions that come with renal failure, the appropriate drug therapy with aspirin or clopidogrel, statins and antihypertensive agents. Hamza, as I said before, have done a fantastic job running the dialysis unit here. It has helped patients live longer. I've had patients here for years who have been maintained on dialysis that in other parts of the world probably wouldn't have. For me, this is one of the highlights of my career. To have to come here to Seychelles is a gift that I have been given. If I can give back to society and people in general, that's what I do. What I get from Seychelles is the amount of blessings and good wishes from patients, their families and the staff here. And that just keeps me going. So thank you very much.